How do seminoma and other testicular cancer types differ? When it comes to testicular cancer, understanding the differences between seminomas and other types is essential. Testicular cancer primarily starts in germ cells within the testicles and is mainly divided into two categories: seminomas and nonseminomas. Each type has unique characteristics, growth patterns, and treatment approaches. Seminomas are tumors that develop from germ cells and are generally slow-growing. They tend to stay localized in the testicle for a longer time before spreading. Most commonly, seminomas affect men between the ages of 25 and 45. There is also a subtype known as spermatocytic seminoma, which usually occurs in men over 50. Symptoms of seminomas often include a painless lump or swelling in the testicle, along with a feeling of heaviness. In some cases, men may experience back pain, breast tenderness due to hormone secretion, or fluid buildup in the scrotum. A key feature of classic seminomas is that they do not elevate alpha-fetoprotein levels, which helps distinguish them from some nonseminomas. Seminomas rarely metastasize early and have a very high cure rate, especially when caught early. If they do relapse, it typically involves lymph nodes in the abdomen. Treatment often includes surgery, known as orchiectomy, and may be followed by radiation or chemotherapy depending on the stage of the cancer. On the other hand, nonseminomas arise from different types of germ cells and tend to be more aggressive and fast-growing. They often consist of mixed cell types. Nonseminomas include several subtypes, such as embryonal carcinoma, teratoma, choriocarcinoma, and yolk sac tumor. These tumors are more common in younger men, typically those under 30 years old. Symptoms can be similar to those of seminomas but may progress more rapidly and include signs related to metastasis. Nonseminomas often produce elevated levels of alpha-fetoprotein and human chorionic gonadotropin, which are useful for diagnosis and monitoring. They are more likely to spread early to lymph nodes and distant organs such as the lungs and liver. Because of their aggressive nature, nonseminomas generally requiring more intensive therapy, which usually involves surgery followed by chemotherapy. Some testicular cancers may contain both seminoma and nonseminoma cells. These mixed germ cell tumors are treated similarly to nonseminomas due to the aggressive behavior of the nonseminoma components. Risk factors for both types of testicular cancer include conditions like undescended testicles, family history of testicular cancer, HIV infection, and certain genetic conditions such as Klinefelter syndrome. Understanding the differences between seminomas and nonseminomas is crucial for treatment decisions and prognosis. Seminomas typically have a better prognosis and may requiring less aggressive treatment, while nonseminomas often necessitate more intensive chemotherapy due to their tendency to spread earlier. In summary, seminomas are slower-growing tumors that usually affect slightly older men and have a high cure rate with early treatment. Nonseminomas are more aggressive, occur in younger men, and requiring more intensive treatment due to their tendency to spread quickly. Both types originate from germ cells but differ significantly in behavior, treatment, and prognosis. Always consult a healthcare professional for personalized advice and treatment options.